Hey guys, in this video I'm going to be covering the side effects from the prescription drug Zetia, which is used to lower cholesterol. I'll talk about what it's doing in your body, which will help you understand why you see some of these more common side effects. And I'm also going to talk about 2 warnings that you need to keep in mind, as well as groups of people that want to be really careful when they take this medication. So let's hop right into it. So Zetia acts a little differently. It's not a statin, it's not a fenofibrate, it's kind of in its own class where it actually inhibits the absorption, these are my fancy abbreviations, inhibits the absorption of carbohydrates in your small intestine. That also leads to less cholesterol going to your liver. This is good and bad, and I don't want to get into this in this video, but cholesterol is really critical to how your body works in general. So we can see some possible side effects. Now you're going to see from the percentages in the studies, the rate at which they occur isn't super high, but they do happen. So number 1, at 4%, we can see upper respiratory tract infections. We can also see inflammation of the sinuses, sinus infections at 3%, and arthralgia, which is like a joint stiffness, at 3%. And these are kind of interesting. Again, I don't want to get too deep into it, but that a medication can cause immune system problems when it's blocking cholesterol. But again, cholesterol is very critical to your body. Okay. Now I want to talk about some warnings. I mentioned some people at the beginning of the video that want to be really careful taking this. One of which, Zetia can cause liver problems. So if you have liver problems, hepatitis, those sorts of things, you want to be careful. At the very least, you want to make sure that your doctor is monitoring your liver enzymes, and especially so if you're combining Zetia with some of the statin medications, for example, Lipitor, Zocor, those sorts of medications, because your risk goes up even a little more when you combine those medications. The other group of people that you need to be very careful with is that Zetia can cause muscle pain. It can be mild, and it can also be severe, things like rhabdomyolysis, which can be life-threatening. So there's some risk factors. These are the groups of people that need to be very careful. One of which we've already talked about, taking Zetia with statins. The same goes for the muscle problems. When you're using it with statins or some of what they call the fibrates, which are 2 classes of medications used to lower cholesterol, want to be very careful. Your risk of the muscle pain can go up. Obviously, if you have pre-existing muscle diseases, that increases your risk. If you're older, usually they consider this 65 years of age or older, you're at higher risk. Low thyroid, unbeknownst to a lot of people, cholesterol levels and your thyroid are very interlinked. So if you have low thyroid, you want to be careful. And then kidney impairment. If you have kidney issues, you're not going to clear the drug as fast from your system, and it can increase your risk as well. So let me know in the comments, have you taken Zetia? How did you tolerate it? Did you experience any side effects? How did it work for you? It's helpful for me, and it's helpful for other people that watch the video. And speaking of helpful, I hope this video was, and I'll see you in the next one. Thank you.